How would you feel if your family member died because of the loss of an irreplaceable biological specimen? Mislabeling is one of the most basic safety problems in hospitals and can become a detrimental problem when the specimen you are labeling is irreplaceable. When another specimen cannot be obtained from the patient, this means that this information is priceless, leaving no room for error. It could mean severe injury, misdiagnosis, delay in diagnosis, or death. In a study of identification errors in laboratory specimens from 417 United States institutions, nearly 50% were due to labeling errors. 1 in 18 labeling errors results in an adverse event, and in the United States, it has been estimated that close to 160,000 adverse events occur annually because of mislabeling.
This means that not only is mislabeling a current issue, but it is affecting numerous patients.
Nurse, I'm Dr. Kristen. I need you to label this bone marrow specimen and put it down to the lab. Stat. It's for patient John Doe.
Okay, thank you. Did she say John Doe or Don Joe? I think she said Don Joe. Okay.
Okay, now that we have the bone marrow specimen, let's identify our patient, scan his wristband, and then we'll scan this specific ID band and place it on the label, and I'll take it down to the lab.
Okay. On the MAR, I have John Doe. I'm going to scan his wristband.
Beep.
Okay. And can you tell me your name and date of birth?
John Doe. 72296.
Okay. It matches his MAR and his wristband. Now let's scan the label.
Beep.
All right.
And that's also what I have here, John Doe. And so I'm going to put this specific barcode sticker onto the specimen, and now I'm going to take it down to the lab.
Great.
Change is needed for many reasons. It is needed to ensure patient safety, and although loss of a specimen is rare, it can mean life or death for your patient. Working eliminating these errors is a necessity.
A recent study showed that errors occur in 3.7 per 1,000 specimens from operating rooms and involve the absence of accurate labeling, omission of details regarding tissue site, and the absence of patient name.
As nurses, it is often our job to obtain and label biological specimens. It is our job to protect our patients and prevent error. In order to ensure this, an evidence-based system change is needed. A solution to prevent future mislabeling of your patient specimens include the barcode scanning system at the patient bedside.
Barcode scanning includes patient identification with ID band and barcode, personal patient stickers that print out at the bedside that can be placed on specimens. A study by the American College of Emergency Physicians stated the total hospital error rate in pre-intervention was 0.21%. Although ED-generated samples accounted for only 10.3% of specimens handled by the laboratory, the ED accounted for 20.4% of the institutional specimens error.
This means that after the implementation of the barcode scanner with labeling of specimens, the error rate dropped 52%. Compare and contrasting. The following study shows how the implementation of the barcode scanner decreased labeling errors by showing the rate of errors before and the rate of errors after implementation.
A study shows that there is evidence of how this decreases error. Of the 724,465 specimens collected pre-intervention, 0.42% were recorded as errors versus 0.11% specimens collected post-intervention out of 334,039. This represents a 74% relative and 0.31% absolute decrease.
After a capital budget was prepared, it slowly expanded to high-risk units after success. The cost of the system was seen to outweigh the risk of losing a biological specimen or even a life due to mislabeling. Steps for implementing change. What you can do now. Be extremely thorough with identification and labeling to ensure that it is correct. Go to your administration and suggest the implementation of the barcode scanning system.